Now, healing happens when there is combination of regeneration and repair. Tissues are derived into three groups when we are talking about healing, and they are based, or they are grouped into these different categories based on their regenerative capacity. Now, based on their regenerative capacity, we have labile tissue, and labile tissue are those tissue that can undergo constant regeneration. For example, bone marrow. And within bone marrow, hematopoietic stem cells are that part of the tissue that can cause the bone marrow regeneration. And they are marked by CD34 positive receptors. Now, also stem cells in the basal layer. Here you can see the skin, you can see derma and epidermis, and this part of the tissue that are darker, they are representing the stratum basilae, or basal layer of the epidermis. Also, in our small and large bowel stem cell, we have these labile tissue represented by mucosal crypts, and mucosal crypts can be seen here in this photo. You can see the crypts, and the very end portion of each crypt it consists of stem cell. Another category of tissues that when we are talking about repairing is a stable tissue. Stable tissues are those tissues that normally do not undergo dividing. Like in normal kind of situation, they do not divide, but they may enter the cell cycle in response to certain stimuli, such as cell injury. Example of that can be regeneration of liver via compensatory hyperplasia after partial resection, or proximal renal tubular cells of the kidney. They are stable tissue in response to certain stimuli. They can also undergo this kind of regeneration. Now, the last kind of category that we want to talk about is permanent tissues, and these tissues lack significant regenerative potential because they cannot undergo regeneration via, for example, hyperplasia. What they do is formation of fibrous scar, and they repair themselves in that way. So here you can see the infarction of myocardium in the septal part of the heart, and you can see this whitish appearance of this part of the heart, and that's due to fibrous formation. Now, earlier I told you that in our skin, skin is a livable tissue, and it can regenerate. But if there is loss of regenerative tissue, then repair cannot happen, and that leads to fibrous formation. Now, we want to talk about granulation tissue, and it's the initial phase of repair. There are three things that are hallmark of granulation tissue. They are fibroblasts, which are deposit type 3 collagen, capillaries, which provide nutrients, and myofibroblasts that contract the wound. So via these three pathways, via these three regulators, granulation tissue happens. Fibroblasts, or type 3 collagen, they deposit and they kind of fill in those gaps, and then capillaries provide nutrients for these stem cells to regenerate, and myofibroblasts contract the wound and take two parts of the wound together. One of the mistakes that most students make is they get confused by the term granulation tissue and granuloma. What you have to mind is that granuloma and granulation tissue are two completely different terms and things. So here on the left, you can see a granuloma. I told you earlier, granuloma is the presence of epithelioid histocytes and the fibrous formation around that tissue, that part of the tissue. While when we are talking about granulation tissue is when we have these fibroblasts or fibrosis, and we have the formation of capillaries. Here you can see the capillaries formation, and that's very different, that they look completely different from one another. Now, granulation tissue results in formation of scar. Hallmark of scar is type 3 collagen get replaced by collagen type 1. This is very important to know, and they are mediated by paracrine signaling by a growth factor, and they regulate and they mediate this kind of signaling. Now, there are two ways that scar formation can occur. The first one is primary intention, and that's when we bring the two edges of the wound together. That's called primary intention. For example, we have the suturing of the tissue. And the secondary intention is when the edges are not approximated and granulation tissue is just filling in that kind of part of the tissue. Alright, now there are some syndromes and diseases that can cause delayed wound healing. The most important one is infection that can cause delayed wound healing. Also, vitamin C and zinc deficiency or copper deficiency can cause this phenomenon, and that's because vitamin C and zinc deficiency are very important for this fibrin formation and this this kind of connection of these fibrins together. Also, foreign bodies, because they lead to chronic inflammation, they cause delayed wound healing. Also, we know that ischemia can cause this matter, because ischemia is when there is lack of nutrient to the tissue, and we need nutrient for the healing to happen. Now, diabetes also is another reason that patients are having the delayed wound healing. Keloid. Now, what is keloid? Keloid are when there is excess production of scar tissue, which out proportion the wound itself. Here you can see on this patient that there is keloid formation, and this keloid or scar formation is at proportion the scar itself. And this happens when there is excess of type 3 collagen.